My name's Ibrahim Ali, and I'm a fourth-year dental student at Manchester.
So I'm Thomas Lambert. I'm a first-year medical student on the undergraduate course at Exeter. So slightly unconventionally, I'm a graduate from medical sciences, and I'm now doing an undergrad medicine rather than a grad course. What about yourself? So a bit about myself. So I'm a first-year medical student. I love to travel. At the moment, I'm actually in Poland in an internet cafe. So apologies in advance if anyone else walks past and you hear any weird and wonderful noises. But
I like building computers, and recently I just built my computer, which took a while. But Tom, I think interview prep, we should let the people know what we found personally the most difficult thing in our interviews. So, what was your most difficult interview situation?
Bringing me back to my Exeter interview. So I think Exeter from memory is structured with 7 MMI stations, of which there are either 2 or 3 minutes. And I remember walking into, I think it was the hot topic station, and I put my hand out and said, "Nice to meet you, I'm Thomas Lambert." And the interviewer looked me in the eyes.
Yeah. Do you have any earphones? It's really crackly. Nobody can hear us. Do you have any?
No, I don't. I'm afraid.
Just to come in there, Tom and everyone. If Tom, when you're not speaking, if you could just keep your
it's really crackly.
Yeah. So if you could speak your mic on mute. Awesome. And Ibrahim, if you could speak now.
Hello.
Is that better? Yeah, that's much better.
Right. Okay. I'm going to put my earphones in as well. Okay.
You see my presentation slide?
Just to confirm, I think the crackling was from your end, Ibrahim.
Okay.
Was it? Sorry about that, guys.
Tom, I think you can keep your mic back to normal. It was just from Ibrahim's side, the cracking. Yeah.
Okay, sure. So going back to my scariest interview moment, the toughest time, I walked into the station, the MMI station. I put my hand out to shake the interviewer's hand. I said, "Nice to meet you, I'm Thomas Lambert." He looked me dead in the eyes, looked at my hand, looked at the seat, and just said, "Sit." And at that point, luckily I'd been watching Apprentice at the time, and they'd just done the interview stage. I sort of knew a bit about interviews, something that I could expect to see. And I just had to keep my cool, keep some strong eye contact. And when I left the interview, I said, "Thank you very much. I really enjoyed that." And I think I think that station went okay in the end. But
similar to Tom's, mine was at Manchester, and they were asking about my personal statement, and they go, "So what is this?" And I do Krav Maga, the starts. And I started to explain what this martial arts was, and I was really passionate about it, really enthusiastic, keeping eye contact, and the guy just goes, "Okay, cool, you can stop now." And then it was just quiet, and I was just like sat there like this, like, "Oh, what do I do now?" And it was the most awkward 1 minute of my life. And then they moved on, and then I got it. And I'm studying at Manchester. I'm 4 years in now, but it was one of my worst interviews personally, I felt. But apparently I got it, and I was just like, wow. So we're going to show you a few tips and tricks for general station, so like ethics, role play, stuff like that. I'm going to tell you how we would break it down. So let's get started. You ready, Tom?
Yep, let's go for it. So we'll start with some quick general tips, as Ibrahim said. Of course, number 1 is dress smart. So you don't want to obviously go in looking inappropriate for the session. But one thing that you could try and experiment with is wear something that makes you stand out, like a tie that's slightly edgier, slightly different, and something like that. So also prepare your surroundings. So if we've got you'll be doing your interviews online, I imagine. So make sure your surroundings are appropriate for the situation, not sound, no one interrupting, anything like that.
Not an internet cafe either, wouldn't you agree, Tom?
Yeah. I've learned the hard way. That's probably not the most appropriate. But
exactly.
it is what it is. And then finally, obviously, on your computer, close other programs. Just keep focused on what you're doing, which is obviously the interview.
As well as just a general obvious tip, you've got to practice. If you know what's going to come up, obviously you can't prepare for everything, but if you try to prepare as much as you can, as well as sounding genuine, it comes across that way, and they can really pick out the robots from the actual people. So that's really good. It says there, if you guys can see, use notes. So because it's online, they can't really see what's behind the screen, sort of thing. So I could have like a whole script behind me. Now some of you may be like, oh my god, that's here. It's like a double-edged sword. So it can be really beneficial, because if you forget something to say, you can say it. If you have like a key buzzword, if you have an entire script and you're just reading off that, you can tell. Like if my eyes are looking away from the camera slightly or off, they'll be able to tell that you're not a genuine person, that you're just reading off a script. And you don't want to be doing that. You don't want to jeopardize the online interview, especially because they will have harsher criteria, like, did student look like he was reading off a script, for example, because they're not born yesterday, sort of thing. And of course, be polite. Tom suffered, per se. We had to keep a brave face on. So that's a really important aspect in medicine and dentistry, where I've had patients shout at me, scream at me, accuse me for ruining their mouth, and then the next day they'll apologize, and I just have to brace it. Essentially, I can't show my, oh man, so annoying. Like you don't do that. You keep it professional, keep it composed.
Throughout your career, obviously you'll be put in situations where you have to like stand up for yourself, but ultimately like be polite and keep a calm face, and everything will be okay.
Yeah, cool. Moving on.
Yeah.
Right.
So, do you want to go for it, Ibrahim?
Yeah. So this is a vignette. So this is basically what you would get in real life or potentially online, and you get given a card, and it says on the card what the station is going to be. So this one, if you guys can see, it says you are reversing. So you being the interviewee, you are reversing out of your driveway and you run over your neighbor's cat. Please talk to your neighbor about this. You'll have a minute to read it, and then you crack on. So obviously, if you guys are attending this and you've not done your interviews yet, it'll be a bit of a shock. So me and Tom are going to show you how we would answer it. So Tom's going to be the poor interviewee, and I'm going to be the interviewer. So when Tom's ready, let me know, and we'll get started.
Yeah, I'm happy to start.
All right. Hey, Tom, how's it going?
Not too bad, actually. Pretty good, to be fair. What have you been up to?
Much, man. Last night drinks were really, really good. It's really good seeing you there. Yeah, and I love stroking your pet cat. Yeah. It's really nice. She's really fluffy. You're really lucky to have a cat like that. Like, I wish my cat was a bit more fluffier. Like, it's just... Yeah. What's up? Yeah. Why did you want to meet?
There's something I really need to... Pardon?
Why did you want to meet? What's up?
There's something that have you got a spare 5 minutes?
Yeah,
to just talk about something?
Yeah, I'm pissed. Yeah, go for it.
Yeah, basically, like, there's no easy way of saying this, but I was reversing out of my drive, and
in that new Tesla.
Yeah, I was looking
in that new Tesla, right?
Yeah.
Sick.
It's a quiet thing.
Good.
But I basically I caught your cat, and I have run over your cat, and I know that it's so difficult to sort of like. Yeah, I'm so sorry. Basically.
Were you high? What? Why? What were you, were you texting and driving? What? What happened? Did you get a Snapchat?
No,
You had to
no,
look
it
at
was
it.
just
What's going on, Tom? Seriously, we had drinks last night. What's wrong with you?
yeah.
It-
It was just a complete accident. I checked my mirrors. I didn't see him, and I'm so sorry.
Were you wearing
It's
your
just
glasses?
one of
Are you
those things.
crazy? Like, honestly, like, how can you miss a cat? That cat is so fat as well. Like, what? Were you wearing your glasses, Tom? Like,
Yeah.
seriously?
Yeah, I was wearing my glasses. Yeah, it wasn't. It's something that I'm so sorry that it's happened.
Dead? Is he dead? Is he?
Yeah, so I've taken a look, and I think he is. I think
Oh,
best
my
port
God.
of call is to phone the vet.
When did this happen?
So,
Why
can we
have you
do-
not called him already? What the hell, Tom? Did it just happen now?
As in, it was literally minutes ago.
Oh,
I was just
bloody
reversing
hell,
around,
Tom.
and then I've just come to yours now. I know. I'm so sorry. Like, I think, yeah, what I'll do is I'll phone the vets for you now. If obviously any bills, anything like that, I'll cover it for you. Yeah. I'm so sorry. If there's anything that I can do, like, is there anyone I can phone for you?
And pause. Right. So that was an example of an actor and Tom responding with me. I'm not the best actor, but my friends would say otherwise. But Tom dealt with it really well. So what Tom did was he gave me time. I was very friendly at first. Tom played with it. And whatever the actor says, Tom went with it, as well as Tom adding his own thing, sort of thing. So I said, was it a Tesla? And he goes, yeah, that stuff's dead quiet. So he's making it more interactive. He didn't, no, it was a Vauxhall, or no, it was a Corsa. Like, you don't do that to someone when you just run over their cat. It's a bit brutal, a bit too blunt. So he's let me convey my emotions that way. If Tom goes on to the next, he's already on the next slide. Sorry, I didn't realize. So yeah, going through these points, Tom was completely honest. He didn't lie at all. He tried to get to the point as fast as he could, and that's good because in dentistry or medicine, if something's gone wrong, it's your duty to tell the patient almost immediately, like, hey guys, so I did this. So in dentistry, for example, if you're drilling a tooth and you drill the other tooth, that's a mistake. And you just inform the patient there and then. You go, sorry, something has happened that I didn't plan for. However, this is not an issue. And you explain the consequences of this could happen, this could happen, this could happen. In medical surgery, it's probably a bit more dire. In dentistry, the most common issue is extracting the wrong tooth. So imagine you go in for a wisdom tooth extraction and I pull out Tom's all front teeth. Tom wouldn't be the happiest bunny on the planet. You wouldn't be able to smile. So it's not really good. So you need to be honest and you need to get to the point as well. Anything else to add on that, Tom?
It's also I was going to say it's also incredibly important to read the situation. It, like, in that sort of vignette, that scenario that we talked about, we had a bit of small talk before. It probably wouldn't have been appropriate to jump straight in and say the bad news.
Yeah.
But you can't beat around the bush. You need to get to the point as quickly and as efficiently as possible, but also obviously show empathy and show that you're there for them.
Exactly. As I said before as well, Tom let me express my emotions. So when I was angry and accusing him, Tom didn't say, no, it wasn't me, it was my sister who ran you over, or X, Y, and Z. Tom fully accepted the blame. If it was appropriate. If Tom, for example, wasn't driving the car, I wouldn't be able to reasonably be angry with Tom. But because the vignette said you ran over your neighbor's cat, he had to take accountability. So when I said, were you on your phone? Were you high? Are you drunk? What the hell's wrong with you, sort of thing? Tom just said, obviously the good answer to say there is no, because if you said yes, that shows you're not really a professional person. So obviously stick to the most moral and legal way of driving a car, which I'm sure all of you know. So that was very good. Tom took it on the chin. So he's not going to say, no, I didn't run over your cat. It was just a little bit. I ran over his foot. He took full responsibility. That was good.
Yeah. It's interesting how this goes back to reading the question. It's interesting how you can read the question and assume a certain way of answering it. I imagine the majority of people that read the question about running over a cat will assume that you've killed the cat, you've completely run it over. But you can make it a little bit easier for yourself if you say, oh no, I've just caught his foot, just caught his tail, something like that.
Exactly.
And then that allows you to control where it's going a lot more.
Exactly. So the best interview is when you're controlling the interview, because that way you're in your natural element, you're controlling, you're talking to the interviewer. It's not that you're being bombarded by questions or accusations. So when me and Tom were actually practicing this last night, I go to Tom at the end, well, why did you say the cat was dead? Why didn't you just say, I ran over his tail, but I came rushing over you to tell you? Straight away, Tom has lessened the impact, and I can't really be that mad to him. Like, it's just the tail. We go to the vet, we can go fix it. He's not dead. But if you assume that he's dead, when it does not say that at all in the question, do you know what I mean? So points in this station is purposefully being creative and playing along or controlling the situation. So that's a really strong skill to have. So like in A-level questions that you get, you've got to read the question carefully. If it says describe or explain or compare, you've got to answer the question. You don't go off on a tangent sort of thing. So it's really important you do that. And the last,
so you can make it easier. Sorry, you can make it easier or harder for yourself by depending on how you interpret the question. So just be aware of that for one of these style questions.
Exactly, because coming up after this, we've got another scenario, and I want you guys to think about the question and how it could pan out. The last point here, Tom thankfully didn't say, "Oh, it's all right, I'll get you another fat fluffy cat." That's the worst thing to say. You can't replace something that's beloved to someone. Do you know what I mean? So you don't just offer someone a new thing. It has sentimental value. So you've got to appreciate and respect that. And that's important on bigger scales as well. But this station sees how you as a person value things. So if Tom just said to me, "Oh, why are you crying? Like, I'll get you a new cat. Cats are done." First of all, that's not nice. I like cats. Secondly, that's not the appropriate stance to take here. It's just completely offensive, and he's not being empathetic or sympathetic. But yeah, other than that, Tom answered that greatly. I'd pass Tom on that interview. Good job.
Thank you. Over to the next scenario.
Yes.
Okay. So, Ibrahim, you're a first year student, and your fellow student, which in this situation will be me, is not washing their hands after examining a patient. Please, could you discuss this with them?
Sure. All right. Ready when you are.
Yeah. I'm good.
Hey, Tom. You all right?
Yeah, man. Not too bad. How are you?
Cool. Yeah, I'm chilling, man. Chilling. It's a pretty boring lecture, right?
Yeah. It's like loads of the stuff's pointless with that.
Yeah, exactly.
It's just irrelevant stuff.
Anyways, basically, remember how we had clinics yesterday or something like that? We were seeing patients. We were seeing patients, right? And I know you wash your hands at the beginning because we all had to do, 7-step happy birthday to you, all that stuff. Yeah. When you saw a different patient, you didn't actually wash your hands. Did you realize?
As in, like, I washed my hands before, like, do you know what I mean?
Yeah.
Like,
No.
I don't really feel like you need to.
No. Yeah. Exactly. You wash your hands, but I mean, like, because when you see a new patient, you might transfer disease, or it's a bit. Did you forget or something? Like, why didn't you wash your hands?
As in, I didn't forget it. As in, I washed my hands before. I don't understand.
No, mate. No. After the first patient, did you wash your hands again?
No.
And that's because you washed your hands the very first time.
Yeah.
Right, but Tom, I don't know if you realise, but there's something called COVID-19 going around, and there's a big emphasis on.
I know what that is.
Yeah. Oh, no. I'm not saying you don't. I'm just saying that research has said generally that washing your hands is a lot more hygienic. It reduces transmission rates of many diseases and many bacterial infections. Well, we've covered that in the lecture.
Yeah.
It's dead boring, but it's like something serious, Tom, because you could infect the patient with something. Like, do you realise that?
Yeah, I bet like I'm not the only person who doesn't do it. Like maybe I'll wash my hands a bit more, but every time is that.
I mean,
Sorry?
yeah, I mean, and then I saw you wash it between another patient, but you only did the 5 steps, and we've been taught 7 steps, Tom. Like, there's a reason for that as well. Like, there's research. Like, don't take my word for it. Like, I'm just telling you what the tutor told us. Do you get me?
Okay. Yeah. What do you reckon I should do about it? Then? Wait. So like every patient, is that
every patient, like,
7 steps again?
Yeah, every patient, 7 steps with soap. Like, you got to do it between every patient. Like, if you don't do this, Tom, like, I'll have to tell like the year lead or someone like that. Like, I don't know what else I can do. Like, I'm just trying to warn you before you get into bigger trouble.
Yeah, I get what you mean. Yeah, I'll try and do that from now on. Should we stop it there?
Yeah. Perfect. So, going on to the next slide. As you can see, Tom had dirty hands. Not bribing patients, but, not washing his hands. Tom, do you want to go through these points?
Yeah, so once again, is going back to reading the question. You don't know the sort of relationship you have with this person. Best friend, they might be a lazy friend that you can banter with, or they might be someone you hate, but ultimately it doesn't matter. You need to get the message across to them that they are incorrectly washing their hands and that they are going to need to, like before seeing every single patient.
Yeah, exactly.
As a healthcare professional, obviously you've got a duty of care for your patients. So if you're not washing your hands, especially with COVID-19, you're potentially putting them at risk of getting the virus or anything else by that matter.
Yep.
And then, you need to appropriately diffuse the situation and calm them down. You can't leave it all flared up and everything like that, because that's not resolving the situation. And I can't imagine you would pass the station for that.
Exactly. Tom, do you mind muting yourself when you're not speaking, by the way? Because the cafe is really loud. Is that all right? Cheers.
Sorry.
Thank you. So just to add on to that, what was it called? Going into a healthcare profession, your biggest duty, number one, is the patient. And if the patient's well-being is being infringed upon, or it's not the utmost excellent care or quality, you're not doing your job properly. So it's especially important to know, as a student applying, not even just mine and Tom's situation, but as a student applying, you need to know that the number one person in healthcare is always the patient. So because Tom is increasing the risk of transmission and disease and everything, like I've explained, quite like relatively, like you guys don't need to know the exact researcher or research paper who said washing hands is better. Like, I could have said Fleming Weiss found out that washing his hands in between pregnant women deliveries increased. Do you know what I mean? Like, you could do anything, but to convey the point that you need to be protecting the patient is number one. And that will be a big marking point. Has the interviewee realized that the patient is at risk and the patient being is being infringed upon? So you need to look after that. But yeah, that's it. I think I did okay. I don't know what Tom thinks answering that question.
Yeah, no, you did a great job with that. Just add that obviously in some situations where professionalism is involved, you need to evaluate whether it's appropriate to get a senior member, like a senior member of staff or a head of year involved. Obviously Ibrahim was able to calm me down, get the message across without the need for that. So it's important that you're able to save face and do that wherever necessary. But if I was to have put up a fight and, verbally put up a fight and disagreed and continued not washing my hands properly, then it would be appropriate to get a senior member of staff involved.
Yeah, exactly. So it's important as well to know about the consequences after this. So like I said, I'll have to inform the year lead or the clinical tutor nearby. You guys don't need to know the exact name. They won't expect you to know at Manchester they have clinical lead or clinical supervisor. You just say, I'll have to inform the head of year or the head of school even eventually, because you're doing such a big thing against the patients. If it was like, there's not many things really that you can get away with, because a lot of things that you try to cut corners on will directly impact the patients. You can't not wipe down. You can't not wear a face mask or wear gloves or re-wear gloves or re-wear face masks. These are protective like equipment that you have, PPE. These are things that you have to wear, especially with COVID now. Especially, they will definitely ask things like this. Like, you see your mate reusing a face mask with the patient, deal with the situation. So same thing as before. You don't need to know the research, because loads of research are conflicting anyways, but you need to hammer home the point of it's a cross-contamination issue. You need to be safer and do it in the most appropriate way. So yeah, that's really it, essentially. Should we move on, Tom?
Yeah, sure. Okay, so the euthanasia question. Shall I take this one, Ibrahim?
Yeah, so Tom's answering it. So like you guys can read here. So if you guys take a minute as well with Tom, read the question slowly. So if you realize there's 2 question marks, so that means 2 points. So if you only answer 1 point in the allotted time, you lose. So you need to be able to answer 2 points. If the interviewer is pushing you to answer only 1 point, then that's fine. You just stick to whatever the interviewer is saying, because it may change. It's completely flexible. So don't feel like Tom can't be like, oh, Ibrahim, shut up for a second, I need to answer this bit. You don't do that. Tom just goes with the flow with whatever I'm saying. So I'll ask Tom, hi Tom, I hope you had a read of the vignette. What are your views on euthanasia, and could you answer part 2 as well? Please explain your answer to me. Thank you.
Okay. So obviously euthanasia as a topic is extremely complicated, and it's one of continued debate and it will be for a number of years after this. But the current stance in the UK is that it is illegal to euthanize patients. So there's many different types of euthanasia, such as involuntary and voluntary, but ultimately it's ending someone's life to actively to sort of reduce their suffering. So there's quite a few arguments for and against euthanasia, but particularly I'm going to focus on the 4 because, I feel like that's what I agree with more, I guess. So you've got to appreciate the pillars of the medical pillars, ethics pillars. So you've got to respect the patient's autonomy first and foremost. So if they are in suffering, they're in pain, and they want to die, and they have wanted this for a period of time, then stopping them from doing so, that's not respecting their autonomy, and it's important to do that at all times. And the state, is it fair for them to step in and stop a patient being able to make a decision for themselves? I'm not sure whether it is. And then beyond just respecting autonomy, you've got to consider not being, as a doctor, being non-maleficent. So you've got to do no harm to the patient. So effectively, if you're keeping a patient alive whilst they're suffering, they've made it verbally clear to you and their family members that this isn't what they want anymore, then is it appropriate to keep them alive?
Could one argue,
as far as beneficence,
could one argue, Tom, then that death is the ultimate suffering? How do we know that actually allowing that person to die is better than letting them suffer, per se? Do you know what I mean?
Yeah, I guess you have to respect the autonomy of the patient. If that's a view that they stand by and they want to, you need to do what's in their best interest. And if that's what they want and they're currently suffering, then beyond just that, it's also important to consider justice. And if a patient's in severe amount of pain, everything like that, they're suffering on a daily basis, this has a knock-off effect on their family and friends as well. So if they, as harsh as it sounds, and don't necessarily agree with this point, but if euthanasia was possible, the stress of the situation, like the family members might be in a more manageable situation. And yeah, ultimately, like, I find it difficult to make a decision and make a stance on such a with the experience that I've got, and I'd like to have a lot more experience before choosing a stance. So at the moment, I'm sort of swaying towards making euthanasia legal, but
Right.
yeah,
Sure.
but I wouldn't like to make a decision now.
Cool. We'll call it there. So that was great. I think, what do you guys think? Was that a decent answer? There's a lot of comments. Yeah, so a lot of people are saying, is it possible to stay on the fence? Non-maleficence, blah, blah, blah. Yeah, so we'll come on to what Tom said as a key buzzword, the four medical pillars, four ethical medical pillars. And if you need to know that or not, sort of thing. Obviously, you guys have heard of it now, so you know it, so you should know it. But Tom's overall answer was quite for euthanasia. For this topic, literally, as Tom said, it's so complex and diverse, and there's been many debates on this for such a long period of time that it is very difficult to pick one or the other. So Tom's argument was a lot for euthanasia, and when I came in with, do you not think death is worse? Kind of didn't par it off, but he just like played it down. He's like, no, but suffering's worse, which is a fair enough. And I'm just playing devil's advocate here. But in a different scenario, so let's say, what are your views? So for a dental question, for example, what are your views on public water fluoridation? I think Megs may know this, or sugar tax even, something more medical related. You need to be able to give a balanced argument. You don't need to know such great depth of like, oh, this act passed and that act passed, but you need to have a general idea of big hot topics. So in medicine, euthanasia will be asked. It's not really a dental topic. Like I said, fluoridation in water, because that's like the argument of mass medication. So is fluoride controlling our brains? Is the government part of a conspiracy? That sort of thing. So those are the counter arguments, and that is a very strong counter argument, which is why a lot of counties in the UK aren't actually fluoridated, and those counties therefore have the highest tooth decay rate. So yeah, if you're a dentist, you read about that sort of thing. So there are big hot topics that they'd expect you to balance out and then pick one side or the other. Another thing that Tom did really great upon is actually summarize his points at the end. So he goes, initially he started off with it's very complex, and then ending wise he goes, this is still a very complex topic, because he's not saying my answer is a solution to all of it. There you go, guys, GMC, done your job for you. He's not taken that stance. That's very arrogant of him to do so. He's done a very non-objective, let's get the words confused, but he's done not as opinionated matter on it. So it's pretty good. Tom, do you have anything else to add?
So basically, just keep a structure in your head. So like quite often, more often than not, it will be a complex question. So show an appreciation for this at the start. Define any terms that are used, so euthanasia, and then follow a structure. So go down the 4 principles of medical ethics. If you haven't come across this, this is a great set of terms to get used to and structure your answer around. And then wherever necessary, comment on the competency and capacity of the patients and the people involved.
Someone just said, what's the best way to respond to curveballs or when an interviewer plays devil advocate? In any scenario, not just ethics, it's an easy one to use it on. Curveballs like me and Tom faced in our interviews when they just completely dead it. They play bad cop. You just got to put a smile on and you got to brace through it. At the end of the day, they've picked you as an interviewee out of hundreds of people. Oh, Tom, are you still there? Tom? Yeah, he's still there. Yeah, he's still there. Sorry, I thought you got disconnected. And so, what was I saying now? Curveball. So you just got to brace it. Unfortunately, this is the thing they'll do, and they'll test you in stress. So another question that can come up on MMIs or just interviews in general: how do you cope with stress? So everyone's go-to answers: I play piano, I play violin, I carve mahogany boats, whatever wonderful and amazing thing you guys do. But then in the interview, in a very high stress situation, they might just not look at you, play completely dead, fold their arms, talk to the person next to them. They could completely ignore you. You just got to have some practice, which we'll get on to the very end, talking about what getting into med does. You got to have some practice in these sort of scenarios. It's difficult to do it with family and friends, but we'll get on to more on that later. Anything else you want to add, Tom, for this ethics question? And sorry, guys, if I'm missing any questions as well. It's quite difficult because I'm on the iPhone and it's spamming the ways through. So yeah, go on, Tom. Sorry.
Yeah. So with any curveball questions, it's so easy to listen to it and just rush straight into an answer. But just take a second, just breathe, process what they've said, and then give the answer your best shot.
Give me 1 second, Tom. I'm just going to grab my charger.
Okay.
I'm about to die. Can you guys?
Yeah, we can hear you.
Okay, great. Carrying on then. So we go to the next slide.
Yeah. So
1 second.
tell me when you're ready, Ibrahim.
Yeah, give me 1 second. Sorry about that. Pum, pum, pum. So we just did the ethics one. Right. Cool. So this is a classic one. They will 100% ask this all the time, no matter what. Why do you want to study the career that you're applying to, or why do you not want to study the opposite career? So if Tom went to a medicine degree, medical interview, he might be asked, why did you not choose dentistry, nursing, or pharmacy? And I'd be asked, why didn't I choose medicine, pharmacy, or nursing? So they might ask you directly, and then what attributes do you have? So I think, Tom, are you hitting this one first, and then it's me? Or is it me first?
Well, I'll ask it for you first, if that's okay.
Yeah.
So, if you're ready, why would you like to study dentistry?
Okay, so initially, I'll answer that question by saying why I didn't want to study dentistry. I actually wanted to study medicine, and after researching it and going into it, I found out why. So I actually had work experience at a GP practice, and then I had work experience in general dental practice. And I found even within I had 6 months of work experience in the dental practice, I saw that the dentist saw patients that were part of a family more regularly, more often, had a more personal relationship with the patient. And that was really amazing because quite often than not, the GP and medical practice, if you have, I don't know, a runny nose, you get athlete's foot, you get any sort of medical condition, you see one doctor and then you get referred to another doctor, then you get referred to a different doctor. But as a general dental practitioner, you take the whole holistic treatment plan and you do as much as you can to your own competency. And I found that quite amazing because you go from saying hello, diagnosing, forming a treatment plan, and then formulating the treatment plan. And I think that's such a great thing to have in dentistry, to actually see the fruits of your own work. I personally like this because I like to see things through. I like building things and then seeing the end of it. I don't just like buying it and then hiring someone to do it. So I think dentistry is very unique that you get to play all parts of that team. You are the ultimate person, essentially. I find that quite amazing, to be honest. The attributes that I think are necessary, which I think I've stated, is being a team leader, being a decisive person, because at the end of the day, the nurse, the receptionist, and everyone else working are working underneath you. and they are trusting your guidance, your advice, your wisdom. And so to have that, and that was very clear for my work experience, that these dentists, they know what they're doing. They could literally handle any situation. I saw one dentist actually work with a patient who couldn't speak English, and there wasn't a translator. But because they were in severe pain, he had to actually treat them and just go for the best treatment plan. And he goes, you have to write everything in your notes, otherwise you'll be eligible, or you might be sued per se. And I found that quite amazing. That's quite a scary thing, to having all that response, to call it like, yeah, I'm gonna have to pull out this tooth, or I'm gonna have to do this electively. It's quite a demanding responsibility, and I think I've developed these skills throughout my time. How's that?
Yeah, that sounds good. Nice, solid answer. I think that kept quite nicely to the timing that we're looking for. I think that was about 4 minutes or so.
Cool.
So
Yeah, I'm running out of juice then.
yeah. I'll be 1 moment.
No worries.
Hi guys, just wanted to pop in.
Hey guys, do you have any questions now whilst Tom is gone? So Hiba Chada, how do you deal with a patient that is suicidal and causes harm to them? They expect you to know this answer. They'd expect you to have a nice humane answer if they were to ask you that, but they wouldn't expect you to recite guidelines or recite like very in-depth things. So just general stuff like suicide hotlines, speak to people, speak to family and friends, try and confide in someone, know that you're not alone, sort of thing, is very important. It's not really a dentistry. I don't think we really cover that, but it's more of a medical question. Are all interviews online this year? I think for the year 13s going into their interviews for this year, they will be online. Next year, so people who haven't applied to medicine or dentistry, or who are going into year 13 or year 12, I think they might be in person. It really depends on the COVID situation. Yes, my iPhone did start to run out of charge. Sorry, Hamza. Yes, definitely do not argue with the interviewer. Probably the worst thing. I will definitely pummel Tom if he tried to argue with me. So don't do that. That's probably the worst thing to do. Go on, Tom. Sorry.
Hi guys, can I just pop in?
So is Dia
I just wanted to. I'm just conscious of the time for this session. Can you hear me? Hello?
Can you guys hear me?
Hiya, can you hear me? Yeah, I'm just conscious of the time for the session is sort of winding down. Can you hear Dia, Tom? I'm just conscious that the time for the session is winding down, and so I just wanted to ask if there was any final remarks that either of you wanted to give.
Should we flick to this concluding slide then? Ibrahim, talk through this.
Yeah. Sorry, did Dia say something? Are we close to the end?
Yeah. Sorry, we're slightly short of time. So if we just go to this slide, we'll talk through this, and then I think we'll wrap up there.
Okay, sure. Okay, so quickly, guys. So analyzing this point. So essentially, they're trying to see your passion. So albeit that may be from my voice, my body language, or how I answer the question, mainly the content, really. You want to try and do something that stands out. And if I come across very enthusiastic, bubbly, energetic, it'll be better than the person who is just like, I want to study dentistry because I like teeth in my life. Ever since I was an embryo, I wanted. No, you don't want to come across like some robot, just fod-fedder. You want to come across genuine, like you actually have a passion for it. That answer I just gave to Tom actually is the same answer I used in my King's interview, which I got my offer for. So the guy asked me, why do you want to study dentistry? And then I go, actually, I didn't want to study dentistry. And I let it pause. And then the guy goes, okay, so why didn't you want to study dentistry? And then I go, funny that you should ask that. Because I had my answer prepared for someone to ask me, why didn't you want to study dentistry? So I find it personally, don't know about you guys, but form your own answer and probably steal this idea. Try and take control. I think that's the best thing to do. Tom, do you want to mention what you did on yours as well?
Yeah, so I think the most important thing is ultimately the point of the interview is to identify a future doctor or a future dentist. So you need to do all those personable skills, keep the eye contact, the smile, make them feel comfortable, and that goes such a long way. And also be honest with what you're saying. If you're not good at a certain skill or anything like that, show that show that you're working on it. You're working to improve. Like, they're not looking for the finished article at this point. They're looking for someone with potential that they can make into a fine doctor or dentist. So, yeah.
And I think I've said there's no really right or wrong answer here, apart from you have to show interest in the career, and don't lie about, you know, carving mahogany boats. If you've not done that, don't lie about it. It's a very dumb thing to do. It's one of the worst things to do whilst you're a doctor. Don't over practice because you sound like a robot. So questions like why dentistry, what work experience do you have? It's almost better to just have a layout or have a few ideas. So I like dentistry because of the patients, finishing the job, working with your hands, and talking to people. So working with your hands means you're a dentist. Talking to people means you like talking to people. So that could be any career. And if you pick out the main attributes that you feel like you have, that you've developed, and you want to continue to develop studying at the university, if you show that in an interview, that's amazing. Like, kudos, you smashed it. And yeah, like Tom said, you've got to show an appreciation for difficult times. So like I said, when the dentist didn't have a translator at hand, or another example, when the patient accused the dentist for absolute absurd things, the dentist took it on the chin. So yeah, and just quickly to end, Tom, if you go on to the last slide. So I don't know if Tom mentioned, but we are part of the company Getting Into Med. I'm the dental lead and Tom's a medical representative. If you guys have any questions, you go to our website and you'll find our email or contact us there. And that's our Twitter that we try to use. I know we're really pushed for time. I hope this was very helpful. Tom? Yeah, you can email us. So yeah, like I said, gettingintomed.co.uk. Tom, do you have anything else to add there?
Yeah, just thank you very much for everyone that's taken the time to watch this. I hope that it's been useful. Sorry for some of the noises that have gone on in the background. I've done the best job that I can. But yeah, thank you very much, everybody.
Thank you guys so much. The session was very, very useful and the audience loved it. So thank you so much for joining us today.
Can you